All right, well, good morning. I am excited to celebrate Men's Health Awareness Month this month with Mayor Watson, Councilmember Harper Madison, Austin Public Health Director Adrian Stirrup, and Larry Wallace Jr. with the Black Men's Health Clinic. This national awareness campaign is done each year in June, and as we prepare to honor Father's Day and some of the special men in our lives, we also highlight the ways we can improve their physical, mental, and behavioral health. Bringing attention to the health of a single demographic group is not a zero-sum situation. The goal is not to divert resources from anyone, but to highlight that biological and social determinants of health require tailored responses to be most effective for men as well as women and gender minorities. If we fail to prioritize the health of any one group, it impacts the rest of their family and community. In this case, it means that disregarding men's health causes many more people, including women and children, to also suffer. Some health challenges are faced uniquely by men, such as prostate and testicular cancer, but there are also many medical conditions that are not sex-specific, such as melanoma and diabetes, that have widely different survival rates among men and women. Similar disparities exist for mental and behavioral health issues. For example, nearly 4 times as many men die by suicide than women. The disparate impact is most vividly summarized by life expectancy at birth. Currently, women in the U.S. are expected to live 79.1 years, but men 73.2, a gap of nearly 6 years. And if you look at black men, that gap grows to almost 12 years, to 66.7 year lifespan. And if we look at the recent trends during the pandemic, that lowered life expectancies for all groups, but men even more, exacerbating this gap. So I think it's today important to remember that while these numbers represent average life expectancies, they aren't inevitable, and we can do things to close that gap and to make a change so that we can increase the lifespan for everybody. So what we need to do, first, regular preventive screenings, balanced diet, physical activity, wearing sunscreen, not smoking, maintaining supportive social relationships, all these things will benefit everybody. And as we raise awareness today, we want to spread the word to help to increase and normalize these habits. And now I would like to introduce Mayor Watson to say a few words before we present this proclamation.
Great. Thank you, Councilmember. Really all I want to say is thank you. Thanks for making a priority men's health and for making an effort to help assure people know about what's going on. I'm here on June 8th, 2023. Getting ready to be the mayor that presides over a city council meeting. And the reason I mention that is when I was in my early 30s, I was diagnosed with metastatic testicular cancer. Went through multiple surgeries and chemo, and then a couple of years later on a routine CAT scan, they found another tumor in my abdomen that was related to the original cancer. And they field dressed me, went in and took out the lymph nodes. But the reason I tell you that story is I am getting, on June 8th, 2023, getting ready to do what I'm able to do because of early, effective, and frequent health care. And part of that was that I knew a little bit about screening and being able to catch something. It was bad, but it was early enough that it makes a difference that all these years later, here I am. So I want to say again, thank you for what you're doing to call attention so that other people many years later, like me, will be able to live the kind of life where, they're achieving their ambitions, they're achieving their goals, hope matters, and early, effective, and frequent health care will make a difference. So thank you all very much, and thank you, Councilmember.
Thank you very much. Now we'll read this real quick, and then we can take take a group photo. So be it known that whereas despite advances in medical technology and research, life expectancy for men averages almost 6 years less than women, with an even greater disparity existing for racial and ethnic minority groups. And whereas life expectancy in the United States has recently declined across demographic groups, with the most significant declines occurring for men, particularly men of color, creating an even greater disparity. And whereas men who are aware of the value that responsible practices and preventive health care can play in prolonging their lifespan will be more likely to participate in health screenings and model behavior for others. And whereas during National Men's Health Awareness Month, our nation recommits to improving the health and well-being of men and boys across America and encouraging them similarly, like the Black Men's Health Clinic, to make their health a priority. Now, therefore, I, Councilmember Ryan Alter, on behalf of Mayor Kirk Watson, do hereby proclaim June 2023 as Men's Health Awareness Month.
Thank you. We are really privileged and honored to be here. The Black Men's Health Clinic was created about a year ago, and our focus is on all men of color. Black and brown men suffer the highest rates of disparities, and yet they're the ones that have least access to care. There are lots of places where you can go and get health care, but our goal is to reach those men that are currently not in health care. And we try to remove the barriers. Some of those are economic, some are bad experiences, some is institutional racism, some fall just in the area of lack of information. And so we're here to really help address those issues. We don't want to duplicate what's already there. There are plenty of services that are funded through public dollars. Our role is to enhance what's already in place. Do the things that others can't do as far as reaching men of color. We have unique strategies that we use. We go to where men are. We use certain programs like sponsoring basketball leagues. We have a barbershop program where we'll pay for your haircut if you come and get an exam. So everything is on the table for us as we try to reach men. Our services are in 3 categories. It's mental health, it's physical health, health screenings, and social determinants of health. And so our reach is broad, and we couldn't do it without our partners. We have over a dozen partners that are working with us. We do have a clinic, which is located right at 290 and Cameron Road, but our services are not limited to just one location. We leverage our partnerships with others. We appreciate Austin Public Health, who is a major funder for our services, as well as others. We believe that we do make a difference, and so we just appreciate the opportunity to be a part of the solution. Thank you. Thank you, Mayor, and thank you, City Council members.